So hello students, we'll be discussing about anti-anxiety drugs today. So anxiety, as per definition, it is an unpleasant emotional state with fear of future threat. It could be either some particular defined threat or it could be the undefined threat as well. So what would be the symptoms if we are going through anxiety? There'll be something like difficulty sleeping, there'll be irritability, or there'll be impaired concentration, there'll be constant fear, there'll be fatigue, there'll be excessive worry. So these are some of the symptoms of what we feel during anxiety. So always, it's not always a pathological state to have some anxiety. Some degree of anxiety is okay to have, but not always, because if a person is having anxious feelings all the time, that should be needing a treatment. So what do we have in the part of treatment for anxiety? So we do have anti-anxiety drugs. These are mild CNS depressants. They'll just depress the nervous system. And these are the class of drugs. These are the class of drugs which we have. So we have benzodiazepines. We'll just go through each of these drugs. Azapirones, sedative, antihistaminics, the antihistaminics which have sedative property, and we have beta blockers. So we'll go through one by one. Benzodiazepines, they'll be acting by increasing the GABAergic action, so that the chloride channels will be opened. So chloride will be influx into the neuron, so that there will be a lot of negativity, so that there will be calming down of neurons. So in a very brief way, the GABA activity will be increased with the action of benzodiazepines. So what happens if we keep on taking benzodiazepines in long run? The adverse effects will include cognitive impairment, there will be a feeling of sedation, and there will be mental confusion, especially in the elderly people, and women, they might be missing the ovulation phase if these drugs are taken for a longer duration. So the first drug which we have in benzodiazepines is chlordiazepoxide. So how to remember this? Chlordiazepoxide. Remember, chronologically, this was the first drug which was discovered and which was used clinically as a benzodiazepine for treatment of anxiety. So he stands first. So let us remember him as the first person to be used clinically, chronologically. Remember, chronologically, just remember this term. It was the first drug. Then we have diazepam. Remember, diazepam is something like diesel. Diazepam, diesel. Remember diesel engine, which struggles to start in the beginning, but later on when the train starts moving, it starts very freely. It goes very freely. So remember, diesel engine, diazepam, the action is very intense in the beginning phases and it goes moderate in the later phases. So if you start taking it in the initial phases, the activity will be very high, and later on the activity of diazepam will start becoming into moderate levels. Then we have oxazepam. If you see, everything will be ending with zepams. So oxazepam, it is useful for people who are already having liver diseases, so the metabolism will not be affected even if the liver disease is going on. Lorazepam, remember, this is a lorry for lorazepam. Lora is for lorry, and it can be given through IM. This is coming out through a garage which is called as a muzzle garage. Remember this like this, muzzle garage. Remember, muzzle garage for lorazepam. Lorry is coming through the garage. Muzzle, it can be given to IM directly. And we have alprazolam. Remember, AL means it is useful for both depression and for anxiety. It is useful for all conditions, alprazolam. And we have clonazepam. This guy is a super clone. He is a super clone. He has superpowers, and he will be useful for acute state of panic attacks, and he will be a very highly potent guy because he is a clone. Remember, the clone to be highly energetic, highly potent, highly useful, and he will be used for acute panic attacks. And also he is also coming from this garage, which is muzzle garage. Remember these two drugs, clonazepam and lorazepam. The lorry and the clone will be coming through the muzzle garage, so that we'll be using it for IM injections also. So why only benzodiazepines, why not barbiturates here is because these benzodiazepines will be more selective towards limbic system, which will control our feelings, anger, emotions, frustration, everything will be controlled by limbic system. CVS will be saved, respiratory system will be saved. The depression is not as much as in with barbiturates. Barbiturates, we don't have these kind of features. Other body systems will be least affected, so benzodiazepines are preferred. Barbiturates will affect other body systems. Dependence, the chance is very low, whereas dependence is very high. Withdrawal syndrome is very mild. Withdrawal syndrome is considerable for barbiturates. Safer in overdosage, so harmful in overdosage for barbiturates. So this is the reason why we've chosen benzodiazepines for this purpose. The next class of drugs which are used for anxiety are azopyrones. In order to remember these drugs, Buspirone and G-pyrone, we'll just watch this short link of YouTube video so that we'll be easily able to remember the drugs. Remember these two drugs, B-U-S, Bus, and remember Z-E-E-P, Zeep, or G-pyrone, Bus and Jeep. Let me go through this video. See, the feeling which we'll get during this is the anxiety. He'll be jumping from building to building. Hope you have seen the game Vector. So they'll be running over building to building, and this is the popular game which will be going on. So imagine there'll be normal street traffic. The buses, jeeps will be going on, and this guy is jumping over the bus. Bus, pay, run. He's be running over the bus. He's running over the bus, over the jeep. So bus, pay in Hindi, and run. He is running over the buses and jeeps, and he is causing anxiety to us. So treatment for anxiety, the specific drug which will be useful for anxiety are azopyrones. We have Buspirone and G-pyrone. Where he has landed up finally, he has landed up on the serotonin 5-HT1 receptor, so that it will be inhibited, the synthesis will be inhibited. Remember, whatever the receptors on the presynaptic neuron are called as the autoreceptors. Whatever you stimulate here will be causing a block of the release of the neurotransmitters. So serotonin is being inhibited from transfer, so that the anxious levels will be coming down. Anxious levels will be coming down just by landing up here, which means the Buspirone or G-pyrone will be acting on 5-HT1 receptor, so that the synthesis of serotonin into the synapse will be inhibited. Therefore anxiety is being relieved. So that mechanism of action differs from benzodiazepines. So we have antihistaminics. Antihistaminics usually have sedative property, antiemetic property, spasmolytic property, amongst which we took sedative property. Remember the drug Hydroxyzine. It's something like the buzz sound of the bee. Hydroxyzine, something like that. XYZ. Remember this Hydroxyzine is one of the antihistaminic drug which has a sedative property, so we can just calm down the patient who is anxious. So beta blockers, imagine you're going to attend a Viva, and you must be feeling your heart rate has been raised, BP has been raised, you will be feeling tremors, you'll be feeling sweating, gastrointestinal hurrying, you will be feeling of passing stools, and you'll be restless. So in order to prevent all these symptomatic relief, there will be no relief mentally. This Propranolol is one of the beta blockers, non-selective beta blockers. It will just block the externally appearing symptoms, externally appearing signs, the features which you'll be experiencing, so that we'll not feel that sweating, will not feel that tremors, will not feel that other feelings with the palpitations, so that we might feel that we are relaxed. Ultimately, there will be better performance during the Viva or any stage performance or any unaccustomed stage appearance or any accustomed things. If you're going to Viva and all, Propranolol will be the beta blocker which will be helpful to reduce the symptomatic and to stop the signs of anxiety. It will not cure the actual anxious processes, but it will just make us get relieved from the things which you'll be experiencing. So what should be the treatment for a chronic anxiety is start the drug benzodiazepines first, and also Buspirone. Remember this drug Buspirone, benzodiazepines. Benzodiazepines, the diesel engine, if you remember, it will act faster in the beginner phase, stronger in the beginner phase, and it becomes moderate. This SSRIs will be starting their action only after few weeks of administration. So completely, in order to have a uniformity in the treatment, we should start with benzodiazepines. Start both of them today, like for example on the day 1, so that this will start immediately and end someday. This will start slowly and it will start raising someday. So ultimately you will be having the ultimate effect of both of these drugs. So start with benzodiazepines, start with SSRIs, start with Buspirone, Buspirone will act after 2 to 3 weeks of administration. So benzodiazepines will take care of till then, and Buspirone will take over after that 2 weeks, and it will start acting and it will start curing. Thank you everyone. Thank you for your time and attention.